kick us off.
Hi, everyone. My name's Robert Boyd. I'm the president of the School-Based Health Alliance. On behalf of the Alliance board, our staff, and our state affiliates, please know that the welfare and safety of you and your family and your teams are our utmost concern. We pray that you are all well and safe. It's my honor to welcome you to today's SBHC peer-to-peer listening and learning session for sponsors and administrators. We're so glad you joined. We also have representatives from our SBHA state affiliates, state program offices, and the Alliance board members are also listening in as well. We've been hosting these listening and learning sessions every week. And over the last 6 weeks, the Alliance has led, sponsored, or participated in webinars, town halls, and listening and learning sessions like these that have drawn well over 10,000 participants. We're learning a lot. But as you know, things continue to change daily. And while the Alliance doesn't have all of the answers, nobody does. We want to continue to provide support to you and to SBHCs by connecting you to each other. In the coming weeks and months, we will be bringing you more topical sessions focused on the issues that you've raised in these sessions. So please be on the watch for those. And finally, as you know, we've canceled this year's National School-Based Healthcare Conference in Denver. We're saddened by that, but we're sorting through the most relevant offerings and we'll be bringing those to you online as well. For today's session, please know that there are no right or wrong answers to the questions that we're asking. We're interested in learning more about your individual experiences and opinions. Your opinions are critical to shaping the future content to address your needs. So now I'd like to introduce our 3 facilitators for today. Andrea Shore is our Vice President of Programs, Tammy Alexander, our Senior Director of State Relations, and Paula Fields is our Director of Programs. I'll pass this on to Andrea now. Thanks, and stay safe.
Okay, thank you, Robert. So welcome to today's session. We are the School-Based Health Alliance, and we work to improve the health of children and youth by advancing and advocating for school-based health care. We believe all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students spend a majority of their time in school. Here's a brief overview of today's agenda. I'm going to point you to our COVID-19 resources on our webpage, share a little bit with you about Zoom reminders for today and how we'll follow up to today's session. And then we'll dive into our discussion questions and wrap up with a little reflection. The Alliance remains open and working to meet the new needs of our field. For more COVID-specific information and updates for SBHCs and our Alliance efforts, here's a snapshot on your screen of our website page. And we've got lots and lots of COVID-19 resources up there from a whole host of many of you and your sponsor organizations, state organizations, national partners. So we're adding to this every week. So we do hope to encourage you to go here, and we'll be sharing this link with you in a follow-up email today as well. So today's Zoom session is being recorded, and we'll be posting it to our website after the meeting. For now, as you joined, you're all muted, but we do invite you to join in today and talk with each other in a variety of ways. First, you will be able to unmute yourself at any point to chime into the conversation. And then we also have a chat box at the bottom of your Zoom screen. If we could click to the next slide, I'll show you what that looks like. Here you go. Here's the Zoom control panel. And you can click on the chat button at the bottom and your chat box will pop up, and you can feel free to add comments in there, ask questions of each other, expansion upon what's already been shared, anything resources on the web pages that you'd like to type in. And we'll also be gathering what you are putting in there to pile all together into a brief summary report for you at the end of today's session as well. And then lastly, we're going to be using Menti, which we had on the top of our screen when you joined, and it's also talked about in the chat box right now. Menti is a web page where we'll be gathering some of your responses to today's questions and then expanding upon those in our conversations. So I'm going to pull that back up in a moment on the screen. But we would love for everyone to try to use Menti. But if you have any challenges getting into the Menti website, then you can feel free to chime in through the chat box to answer questions as well. For Menti, you'll be going to menti.com, M-E-N-T-I, in a new web browser or on your phone. And then we're going to ask you to type in a code that you should see in your chat box. It is 570080. We'll pull that back up in a second for you. Following today's call, we're going to send out an email to all of you. And this will include the slides from today's recording. We're also going to include a survey to ask you about other topics that you're interested in discussing with peers or learning more about over the next several months. We're going to figure out if we're going to continue these listening and learns or deliver content to you in some other variety of ways, in addition to some of the convention workshops going virtual, as Robert mentioned before. We're also going to include in that email an invitation to Basecamp. So you can opt in to join that if you'd like. Basecamp is an online platform where we can continue to collaborate and share resources among each other. It's a real-time online communication tool, and you can drop in resources, you can ask each other questions. We are compiling resources already by content, so it's a great place in addition to our website to continue to gather resources, but really dive in and talk to each other and ask questions as we're all trying to figure out this new world that we're in. Okay, today's topic is mental health, and so we welcome you again. In order to start our discussion, we're going to ask you to enter responses to some questions through the Menti platform, as I mentioned before. So if everyone can go ahead and go to your web browser or your phone, you can see here at the top of our screen the Menti website and the code for you to type in and join. We'll give you another minute so that everyone can get in, and then we'll pull up the next question after your name and position. Great, I see the numbers going up. A few more people have entered their name. Thank you. If you're having any trouble with Menti, please do insert your name, position, organization, state, and zip code into the chat box. We can use that as backup. This is wonderful. People are joining from all over the country. Lots of states represented. So what's going to happen throughout the use of Menti is each time we move Menti onto a new question, you will need to click at the bottom of your Menti screen where it says next question, and then you will be caught up to the same question as us. So right now you'll only see the name and position question. We're going to move on to our first question in Menti and ask you to please take a moment to share with the group how you're feeling about your work and school-based healthcare. You can enter a few words and they'll start to pop up on the screen in a word cloud so we can get a sense of how people are feeling today. Thank you so much for sharing here. We're seeing a wide variety of feelings, and usually the words that are larger in the middle mean that they're being repeated by a few people. So we're seeing hopeful jumping out, overwhelmed, anxious, frustrated, concerned, a whole variety here. Just give it a few more minutes. Great. Okay, we're going to move on to the next question. We just wanted to give a moment for some time and space for people to express how you're feeling in these challenging times. So if you could click on your next question button in Menti, we invite you to please share your immediate challenges, concerns, or fears related to COVID-19, mental health, and trauma. Wow, lots going on here. Thank you. This is very helpful to see. Continuity of care, access to care, provider shortages. I see that coming up in a few places. Suicide risk, isolation. I see student concerns, teacher trauma, family conflict. So lots of different populations of concern. Okay. So what we're going to do is dive into a couple of deeper dive questions that we think will start to elicit some of these immediate challenges and concerns. And we'll be inviting you to share some of the ways you are currently addressing some of them or thinking about addressing them. So we think a lot of these will be touched on today. Thank you so much for sharing there. So the first deeper dive question we'd ask for you to respond to, please, is as we look at immediate mental health support in both currently and returning to school. I saw a lot of you mentioning reentry as a concern for upcoming concern. Who are the target audiences that you anticipate working with or are currently working with for mental health and trauma support? And some of that started to come up in the last question. If you can share that here, then we'll start to talk about some strategies you're all using. I first want to take a look at who you're all working with. Interesting. We're seeing some specific vulnerable populations popping up here. I see middle school students with IEPs, autistic students. And of course, you're all mentioning students. I see families, and then community partners who collaborate with the SBHC. That's interesting. Yeah. Student athletes. Homeless families experiencing students experiencing homelessness. This is very interesting. This is really helpful to get a spectrum of who you're all serving or anticipate expanding your services to. Okay. Okay, now we're going to share some of the ways that you are currently addressing the needs of these populations and what you anticipate doing. And this is where we're going to really get into the meat of the discussion and ask people to unmute and share more. So thinking about the different groups that you've shared and the concerns, I would invite you to start to share what are some of the ideas, strategies, resources. We'll start broadly, and then I'll add some other sub questions if they are not coming out in the responses. But just to start out here generally, what are some of the resources for how you and your team are currently addressing mental health and trauma needs of the students, the families, school staff, all these vulnerable populations you mentioned, and what are some of them that you're anticipating needing to use? And in these, you can get quite detailed in your response. This is open-ended. So if you have any particular resources you want to call out or new partners, you can describe as with a fair amount of detail here. They're fantastic. I'm going to start asking people to share more and expand upon their answers. While everyone else, please do continue to feel free to share ideas here. This is really great and important for us to get as much as possible from you, either through Menti or the chat room. As I shared before, we're going to send out a summary report and invite you to base camp afterwards so that we can continue to collaborate. And the more we can help gather and share among your peers, the better. So I would love to hear, there's so much that you're sharing here that looks fantastic. Somebody mentioned using Cognito at-risk trainings. Would that person be able to unmute themselves and share a little bit more with everyone about what that is and how you're using it?
Hi, this is Kathleen in Arizona. Can you hear me?
Hi, yes, please go ahead.
Yeah, Cognito is a company that creates interactive online trainings for a variety of mental health issues. They've got dozens of them. Some of them are available for free that they've created like in partnership with SAMHSA and the VA and other organizations. But they have a specific suite of trainings called At Risk that are for separate trainings for elementary, middle, and high school staff. And so you can just Google up Cognito, Kognito, and go to their website and get samples and talk to them about using them in your site.
Wonderful, thank you. And does that, when you use it, does that link to, or does it produce data or reports that you enter into or save into the EHR? Or how do you use what comes out of that?
Oh yeah, so the trainings are for, the at-risk suite is specifically for school staff. They have other trainings that are designed for providers, but the administrator who sets up those licenses would have access to pre-post test, progress reports to see who's 70% complete, 100% complete. A lot of their trainings only take about 45 minutes. And like I said, they're interactive. And there's others that could be offered to youth or parents as well.
Got it. Okay. So you're talking. So there's both the training component as well as it can be used directly with the client, with the patient.
Some of them, yeah.
Okay. But the trainings is what you were talking about. Okay, great, wonderful. Thank you.
Yeah, thanks.
Someone also chimed in and mentioned collaboration with the wellness team, and that we'd be interested to hear more about that. If you could share what you're doing with, I'm not sure if it's the school wellness team or the district wellness team, so it'd be great to hear more about what you're doing there.
Hi, my name is Lynn Pimentel.
Hi, Lynn.
I work in the Providence School Department in Rhode Island, and we have wellness team meetings every Wednesday. And it's consisted of the principal, myself, the registered nurse, the school psychologist, and the school counselor and social worker. And we meet on a regular basis and discuss the kids that they were already seeing while they were in school, and also the students that we're seeing that problems are coming up. And we're discussing on, at times we have to report, to DCYF or anything, but for the most part, we reach out and we collaborate with the parents and see what we can do to help these students. So it's an ongoing thing, but when you can't see the kids, you got to do something, right? So we reach out to them, we call them, we do Zoom meetings with them as well afterwards.
Wonderful, thank you. Many people have mentioned using telehealth for either screening or providing care, and it looks like this might be new for some, and others it looks like it was in existence before. For those of you in particular who have just started using telehealth for your mental health services, can you share a little bit about how that's been going and how you're screening and what tools you're using? Or anything related to telehealth that you're using for mental health. It doesn't have to be just the screenings. Does anyone want to share or ask questions of those who have started to use telehealth or who have been using telehealth? Okay, well, pause in telehealth. I have a feeling it will come back up. So I also see a response about a streamlined referral process for teachers. And could the person who entered that into Menti please unmute themselves and share more, or if you're unable to unmute, you can also add in the chat box. But we'd like to hear about the streamlined referral process for teachers, please.
This is Heather Ireland in Anchorage. In the past, we've had teachers go through the guidance counselors, and they, partially because we want the guidance counselor to be making the parent contact for that referral. And so what we're hoping is to have, just because the teachers are so much more connected with the students, to try to either expedite that process or, just come up with a way. We're still problem solving, brainstorming how to do that. But we hope in the fall when school starts again to make that a little more clear to teachers, because I think also they're not really sure how to refer students. So that's what that was.
Great, thank you. Yeah, I was actually curious about that. Are some of them referring now while schools are closed, or this is mostly trying to set up for reentry?
Yeah, more for reentry. I mean, sometimes people will reach out, but usually it goes through the academic counselor first, which is
okay. Yeah, how are others doing referrals through the school? Or is anyone having school staff refer currently? And how are those conversations happening with the school about referrals? Or thinking about it for reentry like Heather just shared? The referral process would be great to hear about. Nothing there right now? Okay, so another interesting one that I see going through the screen that would be wonderful to hear about is that someone mentioned sending home resources by mail, such as some art and other trauma therapy related art resources, DBT. So it would be very fascinating to hear a little bit more about that. Could whoever shared that in Menti unmute themselves?
Yeah, this is Mallory Wood with Illuvian Health.
Hi, Mallory.
Hi. So we started sending resources home to students after our initial 2-week closure of schools. And it's for any of our students that were already pretty far within their therapy. So we had some pretty large expressive arts group therapies going. And those students went back to their homes, and many of them didn't have the resources to continue that therapy. So we mailed home whatever resources they needed, whether it was papers, markers, paint, any of those type items. And then for DBT, which is more focused on our high schools, our providers use various books to support them through the therapy. So we send home those worksheets to students, either via mail or email, whatever capabilities they have, so that they can continue to do those therapies over either telehealth or the phone.
Oh, fantastic. I was actually going to ask, how do you do the follow-up? Okay, wonderful. So they have the resources on hand at home. That's great.
Yeah, and anything blank we can send to them. And then if they fill anything out to return, we have it mailed to our main site, and then we have to scan it into their chart just to keep their HIPAA approved. But.
Wonderful. Anyone else sending home resources to help support your mental health practice or trauma resources? Anyone else doing that exchange where something tangible is going home like that? So so when we were talking about the populations that you are working with and thinking about, I saw a lot more about a lot more collaboration with school staff. I saw SROs talked about, the resource officers, more with guidance counselors. So can some of you share what this enhanced collaboration might look like, or what you're starting to think about and talk about with some of these other staff members in the school that you may have already been collaborating with, or you can share those strategies, or how you're starting to think about collaborating in new ways with other staff throughout the school?
This is Mallory again. We have traditionally collaborated with our SROs. All of our providers sit on a school team that discusses any kind of ongoing situations. But with the recent events, we have quite a few students that we have not been able to reach since school got out. So we've put in place a process for trying to reach out to those students, and we initiate that originally with a therapist. And if they're unsuccessful, then we reach out to a confidant that the student had in the school to attempt a second outreach. And then if we're still unsuccessful and we're concerned about the safety of the student, then we include our SROs at that point to do a welfare check on the child. We've had a significant decrease in our state, I'm sure like many others, in CPS reports. So this also helps to start a file in the event that something were to happen, then this child check would help support any type of case that could develop. So that's how we're utilizing our resource officers. We're fortunate that our resource officers typically have good relationships with the students, so it's not really seen as a punitive thing when they're going to check. It is seen as pretty supportive. So we've been able to utilize them in a little bit of a different role recently.
Wow, thank you. And I'm also curious, just expanding on that, Mallory, and this has come up in some of the earlier listening and learning sessions. How do you set up the infrastructure so that at these conversations that that already existed, where you were talking about providers sitting on the school team, how have you set it up so that information can be shared across the health center and the school staff? Do you have a two-way consent? How are those conversations happening so that you can work this intimately with the school staff?
Yes, so we do have consents from both ways, from us to the school and the school to us. And then our school resource officers are employed by our local police department. So we have to have one with them as well as the school. So it's multifaceted and multi-layered, but and we, most of the time, we're pretty successful in getting those. There are the occasional students where their families are not willing to fill those out. And then in those situations, we have to create a different plan.
Wow, thank you. Yeah, so three-way. And are those, just out of curiosity, so we're trying to, this definitely comes up across SBHCs all the time. So are these, each party is collecting their own consent form, or you have a form that is collecting all in one place?
We do all of our own forms.
Okay.
Just as a health center. So we have, it's this essentially the same form, and then it goes to agencies. And then they complete it. And sometimes we'll get parents that say, yes, you can talk to the school, but no, you can't talk to my child's parole officer. Mm-hmm. So it definitely varies by family. And usually the ones that we can't get a response on are the ones that we really need the response on. Right. So we just try to work with the student as best we can in those scenarios. And then the school has more of a blanketed policy with the police department. So theirs looks a little bit different on what they have the student sign.
Okay. Yep. That makes sense. Thank you. Great. Okay, I also see a resource mentioned up here, NAMI, Ending the Silence presentations. Would the participant who entered that share how you're using the presentations and NAMI resources in general with the group?
Hi, this is Kathleen in Arizona again. Can you hear me?
Yes.
Our local NAMI affiliate out of Tucson has these evidence-based it's another like suite of trainings. These are about 40 minutes. They were originally developed to be done in person, but they are adapting them for online. And we have a handful of folks in our community who have been certified as presenters. And there's one for students in middle and high school, and there's one for school staff, and then there's one for parents and caregivers as well. So just really recommend them. They're great. Mental Health 101, how to reduce stigma and reach out for help or help a friend.
We're many of us in the same boat. Thank you for sharing that. That's great. Others who've used, but I know NAMI has lots of affiliates. Anyone else using their resources in other ways?
Sorry, this is Caslin again. I panicked and hung up.
That's okay.
That's all.
Okay, thank you. So I see up here also increasing alignment in suicide prevention and response. And I did see earlier concerns a lot about suicide and abuse increasing. Can we talk a little bit about some of those concerns? What are you starting to do, or what is your team starting to think about, both related to the enhanced concerns around suicide, abuse, anything in particular with that, and how you're collaborating with the school on it as well?
This is Heather again. I know early on, the district sent out, which I shared with our mental health clinicians, a list of like, here's ways through Zoom that you can be looking for abuse and concerns with families. And then we did have one of our 4 sites recently had a suicide, and the district already had kind of things in place, because unfortunately it wasn't the first one in our fairly large district. But they did some Zoom meetings and just kind of increased communication with families, and looking to identify. They reached out specifically to the group of friends of the individual, and they're going to try to maintain contacts over the summer with those students, because our school's wrapping up this week.
Thank you. Is there a resource out of that you mentioned them sharing some signs to look for through Zoom, et cetera? Is there anything in writing that we might be able to share with this group that we could post on Basecamp after?
Sure, I can try to find it and I'll send that to you, Andrea.
That'd be great. Thank you. Are there others who might be adapting and changing protocols or for suicide prevention, or thinking about it related to reentry? Someone mentioned increasing the number of appropriate professionals trained to identify and respond to a person at risk of suicide. Do you mind sharing there if you're talking specifically about behavioral health clinicians, or are you trying to help get other staff who might interact with students and families to be able to identify? If you could unmute and expand a little on who's getting trained to identify, that would be great. That's okay. I can see if that comes up again. So Just thinking about some of the other questions that have come up the last few weeks, very related to mental health. I'm curious to hear if some of you would be willing to unmute and share how you're managing privacy and confidentiality for your mental health visits, particularly those of you who are doing telehealth visits now that students are at home. Are there some new ways you're managing that? And just even the referral and consent process. So anything that's leading up to privacy, confidentiality, and getting, and also if there's any new and innovative ways to reach students that you might not have been doing before now that they're at home. Thank you, Paula. I see Paula is starting to put in here some of what we've heard from across some of the other listening and learning sessions related to telehealth at home. Some providers shared beginning sessions where they confirmed the student's location and a callback number of a client in order to be able to send help if indicated. And a lot of providers mentioned at the beginning of a telehealth visit, assessing the environment and having students show their space, that there was private space at home, that there wasn't a parent in the room, if possible. And some students, even particularly adolescents, would conduct their visit from a parked car if there's a lot of people in the home. So those were some of the ways that we were hearing some of the privacy issues being handled. I'm wondering if anyone's encountering anything like that or trying out any new strategies in those ways to share.
Hey, Andrea, this is Katie from the Alliance.
Hey.
I'm hearing similar things to what Paula just shared, and then we're also hearing about increased communication with parents. In some situations, that's been a benefit to what's going on currently, in that communicating the need for privacy, connecting more with parents as students are in the home, and that's given sort of an opportunity to build rapport and also to just review the importance of privacy for young people in conducting their sessions and sort of getting parents on board with that. And or it's led into family sessions, which has also in some cases been needed and beneficial. And that's been an increase in engagement, sometimes in parents who weren't very engaged before. Another thing I'm hearing about pretty frequently is people conducting their sessions on a walk. So scheduling some outdoor fresh air time, a little exercise, and also talking with their therapist while on the walk.
Thank you, Katie. So we have Lily, Lily here from New York City, who I'd invite to share a little bit too. She's been sharing with us about some examples of how she's providing and promoting provider self-care. So really helping to support the mental health and wellness of providers during this time. So Lily, if you wouldn't mind sharing, then we could see if others have some thoughts around provider self-care as well. Thanks, Lily.
Sure. So actually, we were just talking about this in an earlier session with Katie. So I'm in New York City. And I work through New York City Health and Hospitals, just to give you a scope of our work. So we provide, we're the public health hospital system for the 5 boroughs. And so, as most of you know, New York City is hit pretty hard. So what's come out of this, though, which has been positive. I think some positive out of this COVID stuff is they've really built in a structure to support all levels of employees under the umbrella of compassion fatigue. And so what's been happening is we have multiple levels available of support for staff. We actually have a behavioral, I forgot to mention this, but we have a behavioral health hotline just for staff, and that's actually manned by mental health professionals within health and hospitals. But then we also have a peer level program, and that's always existed, but now they're definitely shifting to focus on COVID related support, and it's called Helping Healers Heal. And these are peers who just provide, emotional support. And what we've done with COVID is we've expanded it to create wellness rooms and they're like a respite room, and they're staffed by the Helping Healer volunteers. And in the rooms, they'll actually have, water, some relaxation activities. And then if someone needs to talk to somebody, the volunteer is there. I think, and what we're doing is actually doing webinars for employees on different types of topics. And it's sort of like a living kind of model, because first we started off with trainings about, conflict resolution this time, how to work as a team, because people were getting deployed and actually working with different people that they never were working with before, or maybe in a different capacity. I've done some trainings on helping coworkers grieve the loss of coworkers. So unfortunately, we're not only losing loved ones, but we're losing staff, and staff can be just as close as family members. So, and then last week I did a support training on how to grieve the loss of loved ones and how to accommodate, especially with COVID, how do we still mourn and practice public health safety, but also still going forward with funeral services. And then we have topics on things like emotional intelligence, compassion fatigue, and breaking down even to the nuances of compassion fatigue, such as gratitude. I think, in a sense, actually, one of the things I wrote when we did the Menti is like it still feels like not enough. So I think I've talked to people who are on, who actually are like part of the volunteers. What we're trying to do is also bring food and respite to the people, because sometimes, unfortunately, they can't come to the webinar, or they can't go to the actual hospital site to the respite room. So we're our next step is try to how to bring wellness to the tents, or to the sites that are actually out in the field.
Wow, that's amazing. Questions for Lily about that, or anything that you're facing or thinking about related to compassion fatigue? I mean, that's a really robust plan. That's fascinating. Do you have anything? And I keep asking these, but do you have anything explaining that in writing at all that we could share in Basecamp, or it's just kind of being built as you're going?
Yeah. Well, I'm actually in the previous meeting I was in, they were asking me the same thing. So I'm trying to put together, somebody was asking what the wellness room. So actually, it's funny, with our insider page, which is our intranet, they actually have a document now talking about emotional support, and actually shows a picture of the wellness room. So I'll definitely share that.
Oh, wonderful. Yes.
You can actually see what's happening. And then I also have, we have like pamphlets, of where the wellness rooms are at the different hospital facilities. So you also know where to go. So those are stuff I definitely can share, because unfortunately, it's not like a 24/7 thing. Like, it's also volunteer based. So whenever the staff person can be available, that's when the hours are available. Like, they try to make it more accommodating to like 12 to 3 when people are having lunch or downtime. But yeah,
yes.
I'm going to see what I can pull together so you can get like a sense of the different pieces we have.
Great.
And one thing I wanted to share, because we are talking about youth here. So next week, in June, I'm doing a training for parents, employees who are parents, and how to support their own kids, during COVID, like with mental health issues.
Ah, wonderful. Is that open to Is that just for general?
Yeah, it's just for it's just for our staff.
Okay.
But all of health and hospitals. So.
Okay. That's wonderful. Any questions about that program that Lily's talking about? Thank you for sharing that, Lily. I know you have to hop off it too, so I appreciate you sharing that. Definitely will be following up to get the resources to share. Thank you.
Good. No worries.
Thank you. I do see a few programs mentioned that people are sharing on the screen. Second Step. I was looking at a few others before as they were rotating. Can others share what are some programs that you're using currently with students or plan to use and going back? Some evidence-based programs that you might be finding that you're getting staff trained in now or are currently using. And we talked about NAMI, we talked about Cognito. Any other resources that you're turning to or trainings?
Hi, Andrea. This is Katie again.
Hey, Katie.
I've used Second Step in the past, so I can definitely chime in that it's a great, typically presented in the classroom setting, often by school counselors, but can be adapted and is a great social emotional learning prevention program. And I know that lots of school-based health center staff have adapted it in various ways. A lot of these programs have historically been face-to-face classroom delivery, small group, one-on-one. But I'm seeing a ton of them being adapted for virtual use. So I think that if you know of a program that's been helpful in the past or hear of programs, I think that there is a rapid evolution of those becoming virtual and may be able to be used now and when we return to school. So I'm definitely kind of keeping tabs on that and would encourage others to if you have ideas of programs or are interested in learning more, we're happy to help with that. Feel free to contact me, but I would love to hear from others if you're seeing innovations in that way.
Thanks, Katie. And we can keep in any thoughts on programs, you can chime in on the chat room as well. Chat box, sorry. So I'm curious, when we talked about the populations you're thinking about before, a few people mentioned either students with special health care needs or students with IEPs, athletes. Anything that you'd want to share about what your concerns are in particular and how you're thinking about their mental health care, or what you're starting to talk about related to reentry for these students? Curious what people were thinking when mentioning students with IEPs, athletes, students experiencing homelessness. So any special ways you're reaching those students right now or starting to think about reaching them?
Hi, this is Lakeisha. Can you hear me?
Hi, Lakeisha.
I'm with the School District of Lancaster in Pennsylvania, and I work specifically with students that have IEPs. So it covers learning support, emotional support, multiple disability, autistic support, the whole gamut. And right now we've developed like a task force to address different areas, but we have one specifically to address students that have IEPs. So we're ensuring that obviously educationally that they're receiving what they need to get, and that their education is equitable, but as well as the services that are like in their IEPs. So we're actually like providing like our social work services, our speech and language services, everything through telehealth now. And typically where our students would turn in the devices that they were given over like for the school year, when the school year is out, we're making accommodations. So students that we have engaged and got them outside support, if they don't have their own devices, we're allowing them to keep their devices. Also, students and parents that didn't have access to internet service, our school district has actually like partnered with our local cable company, and we have a foundation that is offering like discounted for like families that may have like outstanding bills, and the school district is actually paying for internet service for those families to ensure that they actually have access and that they're able to do our online learning platform, and that's not a barrier because the Wi-Fi hotspots were not working. So that was another option that the district came up with to just ensure that they're receiving those supports.
Oh, wonderful. And did you switch to, was this the first time providing care via telehealth, or did you already have that infrastructure in place?
No, we did not. So it was, I think, a significant curveball for our district to take on. We started with enrichment and then changed over after about 2 weeks to actually where they were providing the direct education so they could grade students. But obviously we're working with educators, so educators don't necessarily look at the same lens as someone does that's like a licensed professional as far as what you can and you cannot do like legally and with your code of ethics. So I think that really took us a lot to like try to educate like our administrators, which is why we have like a whole task force now that just focuses on social emotional like learning and teaching, but for students as well as for staff. And I get everyone wants to help and it's great, but we really had to kind of streamline how we were going to identify the students that needed support, who was going to be the ones to actually either like do the evaluation, the assessment, make referrals, or provide the support. So they were getting the appropriate support from the appropriate professional. So we kind of really had to bring people in so they were practicing within their scope. So that was definitely a big issue. But out of it, but like I said, the one good thing that came out of it, they developed like 5 different task forces to address a multitude of issues, but one specifically is for like the mental health. And we said, you know, everyone's worried about the students, but no one's talking about our staff and our teachers and how they're doing. And, you know, when we have staff members that have family members that pass away, to COVID or even other, you know, other illnesses, like how do we support those families that are now isolated? So they're all things that in this task force, like it was a volunteer, but you didn't have to be like a social worker or a guidance counselor. Like we're taking from all disciplines. So that way we can get feedback from everyone on like what they feel would be the best way, like from their perspective, that we can give the services. And obviously a lot of our staff are parents too. So we're getting, you know, a lot of good information. So when we're developing the programs, that we're giving them exactly what they need. And especially for our kids with IEPs, that we're providing that differentiation that they are required to receive by law. And how do we ensure that we're actually doing that and then remaining in compliance with the law?
That's great. And so the task forces are at the school district level, correct? Or are they at the school level?
Well, it's at the school district level, but we actually, one of the task force actually has community stakeholders involved as well.
Oh, great.
So like the one that's specifically for reopening the task force, reopening the school district has stakeholders from the community. We've invited stakeholders from the community in for our social emotional. So like we're partnering with our like local hospital, some of our main agencies that we work with in the area that provide mental health services. So we've like invited them to join in on this task force. So when we're determining like how the services are going to be given or provided to students, that we have stakeholders from all these agencies that are providing input, so we know what they are or are not able to actually do, and we can develop our program kind of in alignment with what everyone sees as something that's actually that their agency is capable of doing. You know, I have kids that will not have devices because parents have to work and maybe don't have computers or have their own cell phones. And now how do we continue providing telehealth if they don't have like devices? So we're even addressing like issues like that, to have computers that like be refurbished, or people that are donating them to students so they can continue, you know, receiving like that mental health support.
That's fantastic that the sponsor organization is able to be on these task forces early and part of the conversation. That's great.
Well, and we felt to really be effective, and if
Yeah.
we're talking about like mental health more than just what we're doing in the school,
Yeah.
and a lot of our services are outside of the school, we really have to bring those agencies in to support us. So like our local BHDS and, you know, agencies to provide all of our mental health services, and bringing in the insurance company. So in our area, Perform Care is the like overseer of the mental health services. So, you know, to make sure that we're in compliance with what can be approved for students if they have medical assistance, and what Perform Care will actually approve for services, considering how assessments are being done looks very different now.
Very interesting. And are you able to bill for the services that you're now providing to the students with IEPs and
Yes.
and these? Okay, you are via telehealth.
Yes,
okay.
yes, we are. So
Great.
that was something that Perform Care, the insurance companies, did make a provision to allow. It's a little bit different how we have to, you know, do our documentation as previously, but they're definitely allowing for it. I advocated with the district that even if we weren't able to bill, that we're still obligated to provide the service, whether we bill or get any type of compensation, the student still needs the service. And luckily, you know, Perform Care agreed very soon thereafter, and medical assistants made the, you know, the wise decision that, you know, the students still need this. And if, you know, they still said it has to be face-to-face. So like we actually have to see them, so they can't,
not just phone.
they can't like block their face.
Uh-huh.
So even if I could see them for a minute and know they're on, and know, you know, but we have to be able to actually physically see them. And they lowered the amount of time that we have to like necessarily spend in one session. So like typically they were set at like 30-minute sessions, but the form that they gave us, that even if we only meet and do a check-in for 15 minutes, we could do 15 minutes, and that we still owe 15 minutes of like time, and can bill for that later, and it doesn't have to be at once.
Oh, interesting. Oh, thank you.
Which is nice, because sometimes they don't want to stay on that long.
Yeah.
They can at least get on 15 minutes, get an update, find out what's going on, see where we're at, if I'm working on a specific treatment plan or a treatment goal, and then at least schedule the next meeting.
Right.
So that's definitely helpful.
Thank you. That's really, really helpful information. Thank you so much.
Absolutely.
Anyone have questions for Lakeisha or other virtual related innovations or thoughts or resources you're coming across related to the telehealth care?
This is Lakeisha. Can I just have a question to see if anyone is doing or providing group services, what that looks like? In my district, we really haven't been able to come up with a good way to do that, ensuring like privacy. So right now, all those students are receiving like individual support as opposed to group support, and we just like issued a NOREP to the families, so the families would know that they were still receiving the service. Just how the service is going to be delivered looks differently, but the group was just too much more difficult because we couldn't control, you know, all the environments for all the homes, regardless if I make my information that I provide private, just with even, you know, blocking names, like since we have to see them, you know, we just haven't found a way, and I wasn't sure if anyone else has come up with a way to be able to do that successfully.
Yeah, that's a great question. I haven't heard about anyone sharing that on the Listen and Learning. Anyone doing virtual group visits?
Andrea, this is Katie again. It looks like our colleagues at the Weitzman Institute have hopped off this call, but I know that they were actually on the news because they were doing an innovative, similar to what Mallory shared in Montana, mailing supplies to group members and then doing an art therapy group virtually, which seemed really cool. And I know that they have a link to the recording where the therapist talks a bit about that. But that was super innovative, I thought. And then I know that I have heard from others who are, using the Zoom platform to conduct group therapy. And I'm hearing some pros and cons about that works better for some than others. And then we're also hearing a lot about Zoom fatigue and people being tired of staring at everyone else's eyeballs on screens. So I would love to hear more about that too, if others can share about their group sessions or, successes or barriers they're experiencing.
I know this is Lakeisha again. I know for me specifically, the only way, and it's not like a group that I can bill for, but how I've kind of am still engaging my students in like a group process is when I develop my social emotional lessoner group for that week, I record myself presenting it just as if I was doing it right in front of the class. And then I have all the students for that particular class are in what I call my course. So then I ask them to join a course at a certain time. They can actually watch the video while I'm on. I won't see them, but then we have discussion boxes or chats. So that way they can respond by typing then into it. And it's through like our Schoology. So it's the same platform that our teachers are doing, they're teaching through, but I was able to create courses for all my schools. So that way only the school students that are in that particular class know and can see each other, and then they're able to like comment, ask questions, see the presentations or do work, and then they can actually comment in the platform and discussion box, and they may ask me a question. I put their teachers as co-administrators so that the teachers can be involved, see what work is happening, can also answer questions, but then the students can answer questions for each other. So that's one way that I've I'm still trying to do a group, but without actually being able to bill for, since I'm not seeing them. My only interaction is based on them like typing in and responding to something that I've asked in a pre-recorded video, and then maybe a question that I may pose again by typing it in their chat box.
That's very creative, very innovative. Thank you for sharing that. That's fantastic. So we're winding down our time today, and just wondering if there is anything else people want to ask of each other. It's completely open for any questions or thoughts related to mental health and behavioral health care of all the different populations you mentioned. Any innovations you want to share, or last minute comments, resources, and we will definitely invite you to continue these conversations via the Basecamp platform as well. Just want to open it up to anything we haven't talked about yet, or adding on to anything we've talked about. Okay. What I think we're going to do is move back to our final question in Menti, just as a little wrap up. And if you could go back to your browser or your phone for a moment and just give us, we just have one question for you about whether the session was useful. You might have to click on the next question button in Menti. And then what we will do as a reminder is at the end of this, we will, in the next few business days, we'll get out a summary report to you, the recordings from today, an invitation to Basecamp, and then we'll also ask in a brief survey about other topics related to school-based healthcare and in this time, and thinking about reentry. What else do you think is important for the field to talk about or get trainings on, so we can continue to build out virtual offerings beyond these listening and learning sessions this month? So if you could just take a moment to answer this final question, and then you'll hear back from us in the next few days, and we truly appreciate your time and participation today. Once you're done answering a question, you can go ahead and sign out, and we look forward to being in touch and communicating more, especially via Basecamp. Thank you so much.